Gauteng Health Department has announced that it's putting measures in place to fast-track the filling of nursing posts. As part of President Cyril Ramaphosa's economic stimulus plan, 650 new posts will be created, and some 240 of those positions will be used to absorb professional nurses. Well, last week, Denosa, that's a nursing organization, gave the department an ultimatum on the placing of nurses. Let's chat now to Denosa's President, Simon Hlungwane. Simon, morning, and thanks for your time this morning. And you, from your side, what do you understand about what is happening with the training of these nurses and how many of them will actually be placed? Because from what we've read in recent days, Simon, it seems like they've been given notice to go out and find other jobs by February, because the department having said that they can't find places for them.
Oh, well, we are happy that they finally woke up to the reality that they were supposed to have been managing this process. And I can confirm that this is not an Gauteng problem. We have a similar problem in Limpopo, we have a similar problem in KZN, we have a similar problem in Free State, as well as in the Northwest. But basically what they want to do is to retrench employees and nurses in particular. We can't define it in a different way. It's a retrenchment, because those nurses who were doing community service last year, they were employed, they were earning a salary. So immediately they let them go to this year. They are basically retrenching them. Now, in terms of retrenching anybody, they were supposed to have followed a particular process. And I'm saying we are happy that they finally woke up, because this is a process they were supposed to have managed last year, and they ought to have resolved it 3 months before the end of the year. So it simply means that what has happened is that there is poor planning within the department, and we can't define it to anything else except that you can't be sleeping as a manager and not deal with managing problems that are there in particular. Now, we are happy that they are saying they are banking on the package of the presidential stimulus. But if you remember very well, the stimulus was confirmed by the president last year around October. And you ask yourself, why would they wake up in January and think we should take advantage of the stimulus? They were supposed to have done that long time ago. And I think KZN as well has, at some particular point around December and November, said they want to take advantage of that. We encourage them to go ahead and do that. However, we are saying there will be no single nurse that they are going to let go because of their poor planning. We can rather go to a serious fight with them. We're not going to allow that.
So, Simon, just clarify for me. They have told nurses in December already, you have until February to find a new job. So how many are guaranteed jobs, just for clarity, and how many will be left left at sea, basically, to have to go and find a job after having received this training?
Yes. In the confirmation of the according to the feedback from our members or nurses who are affected, is that there could be around half of them that were told they are going to be let go because they have no posts. It can't be our problem that they didn't create posts on time. So, but in terms of the law, you can't indicate to an individual that please note that next month you don't have a job. Yeah. You are required to inform the person timeously. And in terms of contractual employments, you are even required that you should inform that employee not less than 3 months in advance. So for that matter, whoever has been told to be let go does not apply, because it doesn't comply with the law. That's why I'm saying we'd rather take them to a serious fight. We will take them to court and interdict them from doing that. So we expect that from February, all these nurses will be employed fully. But I can confirm that in Gauteng, they have given an indication through the departmental officials that they are working on the process, and they foresee that they're going to absorb everybody.
Because we did have somebody from the department in here yesterday saying to us that they will try and make a plan for the other nurses. But the reason was that there are other costs, there are other expenses, because I asked him, how could you not see this coming? How, there's been money in the past, and the nurses want to know, so how can all of a sudden you do the training and then realize there's no money to pay them in a full-time position? Do you buy that excuse that there are other expenses add up, leaving them with no money to pay the nurses?
Well, the clear definition is poor management. It's also misappropriation of funds. I'll give you an example. When they changed from training nurses through the PESAL system and they wanted to use the bursary system, they used and argued that they are going to save money, like the life asset many processes. But I can definitely confirm that to date they have no evidence of saying they have saved any money. To that effect, it has led them to last year January say they are not going to take any nurse, because they have implemented a process but they saved no money, and they just said we have no money because the money was misappropriated. It was meant for training, but it has been used for something else.
What's the something else, do you know?
Come again?
What's the something else?
most of the time it will go to infrastructure projects, but most of the time is that you...
Are they necessary projects, though? Or do you believe that
some are necessary, but you know the problem with infrastructure is that the cost will start at a certain amount and it will balloon. So you end up paying 10 times more than required. So that's what I'm saying, it's mismanaged, because when you have that process is that the project has been poorly managed and you end up incurring costs that are unnecessary. Doesn't it boggle your mind, Simon, that for years and years we've been banging on about how we have a shortage of nurses, how desperately we need them in our public facilities as well, yet nobody's keeping an eye on the money that would be meant to retain those nurses and add more to the system? It's plainly poor management. And for that matter, if they can wipe up everybody who's in that system, particularly in the Human Resource Department, because this falls within that, and maybe we can deal with the issues. But what boggles us the most is that you can remember the pronouncement of the president. First thing first, he said he wants to realize the realization of the NHI. For us to realize the NHI, we must improve primary health care, and for primary health care to be delivered, you need more nurses. When he's coming from that, he went to the Job Summit and confirmed that he's committing to sustainable jobs. When you come from the Job Summit, we went to the Health Summit. In the Health Summit, he committed to saying we'll be employing more health professionals. After that, he then said in the stimulus we're going to employ more nurses. But in the contrary, now they say they're letting go nurses. It tells you that we have one government with people behaving like that in a federal state where they do as they wish. It's not possible. Simon, very quickly before I let you go, what is Denosa's plan now to fight this? We are engaging them and giving them only this week. Next week, we must be clear whether they're employing them or not. If not, all of those nurses. All of them in Gauteng must be employed, all of them in all other provinces. Otherwise, we are taking to the street and we are fighting this matter. We are not going to allow it to happen. And for that matter, this must include also those who need an opportunity to do community service for this year. And we want a permanent resolve that even next year, we don't have a similar problem. We're engaging the minister this week. We're engaging all other officials and in all provinces. And we want this to be resolved permanently. All right, well, we'll certainly be keeping an eye on the story. Thank you very much for your time, Denosa President Simon Hlungwane.